number if we make
Hi,
it.
I'm Becky. I'm a nurse here at Community Healthcare in Davenport, Iowa. During our process of services we provide, we have identified an area that has caused us some problems, some backup during our day, and it is when patients present and don't need an appointment but need a service from a provider here. They would present at the window to the patient services professional, and one of the things they would ask for is, I need a refill of my medication. The patient services professional would say, we do require a 24 to 48 hour wait. We have that policy here at Community Healthcare. But of course the patient is out of medication since yesterday. So then the patient services professional would direct the patient to fill out one of these yellow slips here. We have them in Vietnamese, Spanish, and English. And they would fill it out. Of course they don't have a pen, so they have to interrupt further to get a pen. And if filled out correctly, they'll have their name, they'll have the date, their provider, if they know who their provider is, and they'll have their reason for what they want, whether I need medication, and hopefully they would put which medication. Oftentimes it's just, I need medication. There's so many scenarios here. So we have this now. They're not happy with the 24 to 48 hour wait. That becomes a problem here at the window. So the PSP says, please have a seat. So they'll have a seat, they'll take this yellow slip, the PSP will take the yellow slip to medical records, who will then pull the chart for the patient.
Do we want to cut?
Okay, let's go ahead and go behind the counter now and follow from there. Okay, the patient services professional will write waiting on this slip to identify that this patient is waiting. She'll leave her seat, come down here to medical records and go, I have a waiting, and walk back and carry on with her business. Medical records will interrupt their time to come up and say, okay, now, if the chart is here, great. We get the chart, she takes it to ideally to the assistant that works with the provider. If the chart's not here, then she's got to go back to the computer. Where did the chart last say it was? Well, for this instance, it's with Dr. Johnson. So she goes to Dr. Johnson's office, it's not there. She goes to his nurse, it's not there. And so now it's, I have this request, but I have no chart. Big problem. So, saying the chart's there, she gets the chart, she takes the yellow slip and the chart, ideally to the medical assistant. So, in this case, we're going to go to Dr. Hawk. So, medical records will come down here to Dr. Hawk. Done correctly, this waiting should go to the assistant with Dr. Hawk, not to Dr. Hawk because he's seen patients. The assistant with Dr. Hawk needs to know, I have a waiting. Does that happen? Not often. Sometimes it goes there for Dr. Hawk to address. So I need medication. This time they've been clear, I need Actos. Okay, so Dr. Hawk looks at it and goes, okay, does that chart, does another chart, does another chart, does another chart, and gives 5 charts to Sarah, his assistant. Sarah doesn't know there's a waiting on the bottom. Now we have a problem because this person's in our waiting room. 2 hours may go by because they're used to waiting. We've told them 24 to 48 hours, and they're hoping they don't sit out there for 24 to 48 hours. But honestly, an hour to 2 hours has and does frequently go by, and they'll come to the window. But Sarah's now at lunch, and they'll get the PSP. I've been out here since 10, and I needed a medication refill. Sarah was going to get it for me. Well, Sarah knows nothing about it because nobody's identified to Sarah this was a waiting for her and that this patient's here. So now the PSP has nobody to go to because everyone's at lunch. They go to the triage nurse who has a patient in there assessing them, who now has to either break away from that patient or, you know, get done with that patient, further extending the wait of the patient already in the waiting room, and take care of this problem. Find the chart. First of all, is her big problem. She's got to find the chart. Where did it go? Dig through the charts that Sarah has in there. One scenario. Yeah, and then the other part of this problem is that we interrupt the doctor during his day. He does typically have charts to go through as he's working his day, but a waiting causes a bigger problem because he can't do it at his leisure. He's got to stop what he's doing because he's got this waiting and address this problem. So there's many interruptions during the day that really cause problems. Another scenario we run into is that they may come to fill out this yellow slip. We get clear through this entire process that I've explained, only to find out that they have 4 refills in the pharmacy. But they can't remember which pharmacy they took the prescription to because their bottle says empty at home. Well, you know, you have a prescription here that says 4 refills. Well, I don't remember where I took my prescription. Then you have to call around to find out where the prescription went. It's either that or interrupt the doctor again to get another prescription. But you need to know where that original prescription went, so one more thing adds to the length of this interruption.